Hello, good afternoon. My name is April Gonzalez, and I'm going to be your nurse for today. Can you please state your name and date of birth, please?
Yes, Venus Sarvi, May 2nd, 1992.
Okay, Ms. Arby. We're going to go ahead and get started with the head-to-toe assessment. Well, before getting started, I do need your verbal consent and some signatures through.
Okay, that's fine. I give verbal consent to do the head to toe assessment.
Okay, thank you, Ms. Arby. I'm going to go ahead and start with the general appearance of the patient. Patient looks well-groomed, no signs of use of medical devices like hearing aids, braces, a cane, crutches, or corrective lenses. Patient has a relaxed posture, no signs of physiological distress, no labor breathing, use of accessory muscles, no bleeding, or any sort of that. Miss Harvey, do you know where you're at today?
Yes, in a clinic in Brownsville, Texas.
Okay, do you know the month, the year, and the date?
Yes, it's July 14th, 2022.
Okay, good. Patient is alert and orientated ×3 to person, time, and place. Her speech is clear and she's very cooperative. I'm gonna go ahead and start my assessment. I'm gonna go start from the head to the toe, okay?
Okay.
I'm gonna go ahead and start by inspecting your head. Patient seems to be have hair distributed throughout the whole scalp. No signs of infestation, no sign of trauma or lacerations. I'm gonna go ahead and start palpating. If you have any tenderness, then please let me know, okay? Do you feel any pain, tenderness?
No, no tenderness or pain.
Okay. I felt no lumps or any or saw any trauma to head. Normal cephalic overall. I'm gonna go ahead and look at your mouth. You're gonna have to open your mouth. Open your mouth. No. Okay. Can you go ahead and smile for me? Frown. Puff your cheeks. Okay. You just use your cranial nerve 7, and your mouth is symmetrical to your face. When you're sticking your tongue out, you use cranial nerve 12, which is your tongue was midline. When you open your mouth, and I saw your uvula and soft palate, it was rise up towards midline, and your tonsils also rise to midline. There's no signs of enlargement of the tonsils or anything like that. And you use cranial nerve 9 and 10. I'm gonna go ahead and put my head to your temple, and could you go ahead and open your mouth? Close it, open it, close it. Okay, after doing this, there's no signs of crevices to the TM joints. Now I'm gonna go ahead and inspect your eyes, okay? Okay, the conjunctiva is pink and moist. Sclera is white and no signs of injected yet. I'm gonna go ahead and use the pen light. Make sure don't move your eyes and just don't move your eyes. Don't move your eyes. Okay. Patient is reactive to light. Pupils are round and equal. Okay, I'm gonna go ahead and get this pen, and I'm gonna do your cardinal field. Okay. Don't move your head. Patient cardinal field is good and intact, and her use of extraocular muscles are normal. No signs of nice stigma. Okay, I'm gonna go ahead and palpate your frontal and your maxillary sinuses. Do you feel any pain?
No.
Okay. Okay, I'm gonna go ahead and point my finger. You're gonna look at it, and then you're gonna look at the wall, okay? Look at the wall, and look back. Do it a few times. The reason I do this is it accommodates a near and far vision. When you use the near vision is needed, the pupils construct and they converge. The pupils converge. Now I'm gonna go ahead and do their nose, and I'm gonna go ahead to put it here and just breathe in and breathe out. Breathe in and breathe out. Okay, patient's nostril nares are patent and is able to breathe. I'm gonna go ahead and now check your ears and do a whisper test. I'm gonna say 3 words on each ear, and then you're gonna have to repeat after me, okay?
Okay. Hello. Bye. 2. 5. 3. A.
Okay, great. Patient's ear hearing is intact and well. Okay. Now I'm gonna go ahead and check your carotid artery.
Okay.
I'm gonna go ahead and do one by one and see. Carotid artery is +2 pulse bilateral and no signs of throw. Now I'm gonna go ahead and palpate your supraclavicular lymph nodes. If you have any, feel any tenderness or pain, please let me know, okay? Pain?
No,
tenderness?
no tenderness or pain.
Okay, that's good. Okay, I'm gonna go ahead and do auscultate your lung sounds. Breathing looks normal. Normal. Your lips are sloping down, and no use of the axillary muscles are used. So I'm gonna go ahead and auscultate from the anterior and posterior.
Okay.
And I'm gonna put my diaphragm on your chest, and every time I place it, you're gonna breathe in, breathe out. And you feel dizzy, please let me know, okay?
Okay.
I'm gonna go ahead and turn around so I can do it posteriorly. It's gonna be the same thing. Breathe in, breathe out.
Okay.
As I move my stethoscope. Go ahead, breathe in, breathe out.
I'm gonna sit down straight.
Breathe in, breathe out. That's fine. You could go ahead and turn around now. After auscultating your lungs, anterior, posterior, they were clear. They're clear. Okay. Now I'm gonna go ahead and start with your heart. I'm gonna go ahead and look at your chest. No signs of masses. No signs of labored breathing or distress. No sign. Yeah. Okay. Now I'm gonna go ahead and auscultate your heart sounds. I'm gonna go ahead and start from your aortic pulse, which is your second intercostal space on the right side, and then the second intercostal space on your left side, which is the pulmonic. And then it's gonna be the herbs in the third intercostal space, and then the herbs is in the fourth intercostal space. The last is gonna be the mitral valve. The mitral valve is in the fifth intercostal mid-clavicle line. I'm gonna go ahead and explain what the diaphragm done. It sees high pitched sounds, and the bell sees low pitched sounds. So now I'm gonna go ahead and auscultate, okay?
Okay.
This is just a brief understanding of what I'm gonna do.
Thank you.
This is the aortic, the pulmonic, the herbs, tricuspid, and the mitral valve. Now I'm gonna go ahead and use my bell to see the low tones. Mitral valve, tricuspid, herbs, pulmonic, and aortic. After listening to your heart sounds, it was normal. There's no signs of heart murmurs, no signs of 3-4 gallops, and S2 sounded loudest at the base of the heart, and the S1 sounded loudest at the apex of the heart. Now I'm gonna go ahead and lay you down so I could do my other assessment. Okay. You're gonna lay down straight. I'm gonna go ahead and touch your skin. Skin is going to touch and dry. It's going to dry lateral, even on your lower extremities. I'm gonna go ahead and check your cap refill. the other hand too. Capricorn is less than 3 seconds and is within normal range. I'm gonna go ahead and check your skin turgor. Skin turgor is instant and normal. Patient's skin is tan and is normal to genetic background. No signs of cyanosis, no signs of erythema or jaundice. Everything within normal limits with the skin. Now I'm gonna go ahead and check your pulses, starting with the brachial all the way down to your feet. I'm gonna do it together. Brachial pulse is +2 in pulses, bilateral, no signs of throw. I'm gonna check your radial pulse. Radial pulse is 2+, bilateral, no signs of throw. Now I'm gonna go ahead and check your popliteal pulse, but I'm gonna go ahead and start with the left foot first. Could you put your feet down, please?
Mhm.
Pulses 2+, bilateral. Don't worry about it. I'm gonna go ahead and check your pretibial edema. No signs of edema and bilaterally. I'm gonna go ahead and check your dorsipedial pulse. Pulse is 2+, bilateral, no signs of throw. Now I'm gonna go ahead and take your posterior. Posterior pulse is 2+, bilateral, no signs of throw. Now I'm gonna go ahead and check your femoral pulses and your inguinal lymph nodes. I'm gonna go ahead and put my hands right here, and then I'm gonna go ahead and You feel any tenderness there?
No tenderness.
Okay. Femoral pulse is 2+, bilateral. No signs of tenderness or inflammation. No signs of masses either. Now I'm gonna go ahead and I'm gonna put it a little bit down so I could inspect your abdomen. I'm gonna go ahead first inspect it. There's no signs of any masses or abnormal pulses bulging out, anything like that. No lacerations or any signs of bruising or of some sort. A patient has no hair. Throughout her abdomen. I'm gonna go ahead and name where each organ is, starting from the right upper quadrant, which is the liver and the gallbladder. The left upper quadrant is where the spleen, pancreas, and the stomach is. On the right lower quadrant, you're gonna find the ascending colon, the cecum, and the appendix. On the left lower quadrant, you're gonna go ahead and see the descending and the sigmoid colon. Okay. But before getting started, I'm gonna go ahead and hear your bowel sounds in all 4 quadrants. Okay. Okay, bowel sounds are active in all 4 quadrants. Now I'm gonna go ahead and percuss on each quadrant. After percussing on each quadrant, you can see the sound of tympathy with a scattered dullness, which is normal within normal range. Now I'm gonna go ahead and palpate lightly, and let me know if you feel any tenderness.
Okay. No tenderness or pain or anything.
Okay, now I'm gonna go ahead and do deeper palpation. I'm gonna go ahead and check for organ placement. Okay. Do you have any pain?
No pain, no.
Okay, everything seems to be normal. No signs of masses, tenderness, inflammation, or organ megaly.
Okay.
You feel no sorts of pain?
No.
Okay. Now I'm gonna go ahead and let you stand up. Miss, sit down, please. So I'm gonna go ahead and check your grip strength. Okay, can you go ahead and squish my hand with as hard as you can? Okay, patient has good strength bilateral. Could you go ahead and go like this? Can you get resistance as hard as you can? Okay, good. Other side. Okay, again. This time. Good. Push against me. Okay, good. Now I'm gonna go do the same thing. Put it. You push. Again. Against me. Good job. Against me. Good job. Against me. Okay. Now you can go ahead and stand up without using your hands to help you. Okay, that's good. Patient did not use her hands. Patient has good strength and upper and lower extremities. Patient has no signs of inflammation on both sides. No signs of deformities on upper and lower extremities. Patient has good strength and good resistance. Upon gravity. Now I'm gonna go ahead and check where pressure ulcers are shown to be for people with immobility. I'm gonna go ahead and name them. It's gonna be in the ears, the shoulders, the scapula, the sacrum, the iliac crest, greater trochanter, and the ischia trobicitor. No, I don't know trobicitor. I'm gonna go ahead. I'm gonna go ahead and look at her feet. It's gonna be medial and lateral maxillium. The heel, the great toe area, is where you would see the most personal injuries in patients who have immobility problems. I did forget one thing where you had your GVT, the extension. I'm gonna have to lay the patient down again to recheck it. I forgot. You're gonna go ahead and 35-degree angle, and you're gonna have to turn your neck that way. Okay, next. Okay, patient has a flat area at 35-degree angle, which is no signs of GVD. And I'm gonna go ahead and check. If I have any, I'm gonna go check my rubric. Please put your password. Put a rubric to see if I missed any mistakes or if I forgot something. Tuberosity. Okay. I also forgot to do the aortic roots on the abdomen, the renal artery, and the iliac arteries. And I think that's about it. And also I forgot, I named the ischia tuberosity incorrectly, which is on the lower of that buttocks. Could you go ahead and lay down so I could go ahead and check your aortic artery on your abdomen?
You can pull it closer so I can see.
I'm gonna go ahead and check her. Okay, there's no notes of Brooks. I'm gonna go ahead and check your renal artery on both sides. It's no signs of Brooks. It's within normal range. I'm gonna go ahead and check your iliac artery on both sides. It's under the umbilical area. Okay, no sign of Brooks. And that's completes my assessment. If you have any questions, Ms. Ari?
No, thank you.
Okay, thank you.